Hello, everyone. Thanks for coming to the Science live stream. It's great to be here with you all. Oh, sorry. So I'm here with the ICEERS science team. My name is Sarah. I'm working the communications team at ICEERS, and we're having a live stream today to talk about the current ambient here in the field of psychedelic science, what's happening in the world, kind of in a general sense, and then also more specifically what we're doing here with our nonprofit. And so we're going to explore different topics relating to the globalization of plant medicine, and then also discuss the specific projects we have going. And there will be time for questions. So along the way, if anything comes to mind and you want to ask the science team, feel free to drop your questions in the chat. And yeah, we'll go from here. So to start things off, the ICEERS has been working in research for quite some time, for over a decade. And so first question is, how did the research team decide on the topics and area of research that they pursue? So Jose Carlos, would you like to start us off?
Hello, good afternoon. Thank you, Sarah, for your presentation. Well, my name is Jose Carlos Bouso. I'm the scientific director at ICEERS. It's a pleasure to be here with you. And well, can you repeat the question, please?
Sure. So at the beginning, when you began working with ICEERS and you started the research program, how did you decide on which topics and areas of research that you wanted to pursue?
Yeah, thank you. Well, ICEERS is a non-profit corporation, a non-profit organization, like Sarah said before. So we work for the public, for the public benefit. So our interests are based in the intersection between science, public policies, and human rights. So although we are, of course, like every scientific team, worried about generating new knowledge and innovation, all our efforts are focused trying to put our intention in solving problems that have some kind of public benefit and that are good for the social community. So for example, we are performing studies. Another thing that do ICEERS and the scientific team has a very hard situation is to go to the trials with some people is arrested or persecuted because is carrying ayahuasca or coca leaf and so on. So we try to design and develop researchers that will or that can be of help in trials where the toxicity of ayahuasca is put into concern. And also, in the case of ayahuasca, and also in the other side, since ICEERS, or at the beginning, ICEERS started with the Benzeloen documentary about ibogaine, we have another interest in researching the eventual safety and security of ibogaine in the treatment of drug abuse. So, in sum, the projects are driven by the social necessities and not specifically because at the side of knowledge and so on.
Great, thank you. Yeah, and you've seen the scene change a lot over the years as well, and it's amazing to see how currently things are compared to even 10 years ago in comparison to 20 or 50 years ago.
Yeah.
So it's an exciting time to do this work. And so to kind of broaden the topic slightly, I'm curious, what are some of the biggest challenges in psychedelic science from the perspective of the research teams? So Janice, is that something you want to speak to?
Yeah, sure. Well, thank you, Sarah, for holding the space. And yeah, well, in terms of improving the psychedelic science in general would be a lot of topics, a lot of different topics. But in terms of research, I would say that maybe the most needed field or the most needed improvement is in terms of the samples used to provide knowledge, no? Because we have these trials, phase 3 trials with a very low number of subjects, no? Or we have these studies in which more than 50% of the sample had previous experience with psychedelic drugs, and we know that this is not happening in the general population. So in the future, maybe we have a problem of external validity, let's say, as we say in science, that is the limitation of extrapolating our data to the general population. No? So it's possible that the findings of our studies are not reliable in reality and in everyday reality. No? So this would be a huge challenge because we are facing in the following months or following years the commercialization approval, at least for MDMA and psilocybin, and we have this limitation. I was reviewing the other day the evidence that we have on Ipericum, on the St. John's wort, and it turns out that we have data of 7,000 people in randomized and controlled clinical trials, no? And with psilocybin we have 200 and something, no? So we have to increase these numbers in order to have more robust information.
Great. Yeah, there's so much about plants that we don't know, especially St. John's wort and a lot of the whole spectrum of plant medicine. Maya, did you have something to add?
Yeah, maybe that one of the things why there is still, the research is still quite limited, has also to do with drug policies, no, which are enabling scientific research. However, there is still a certain stigma in society researching these substances and these plants and these fungi. And that makes it then also maybe a bit demotivating for more people to engage in this kind of research and find funding for it and so on. So that can also be what's making the difference, no, between another plant and a scheduled plant.
Yeah, I think that there is another challenge in psychedelic research nowadays. That is that there is a tension between biomedicine and the communalistic use, and there is a lack of disciplinary research, and so maybe we are, now that the biomedical model is gaining recognition because of the clinical trials and so on. The truth is that these substances are substances that are now medicinal plants that have been used by humanity since many centuries ago, and they are keep being used. So maybe it's necessary to have multidisciplinary and interdisciplinary dialogues. And of course, inter-epistemological dialogues also with other epistemologies and other systems of knowledge that came from the indigenous people. For me, this is the most interesting challenge that we have in the near future.
Yeah, it feels like there's a lot of challenges facing researchers, and I imagine it must be frustrating to want to pursue different avenues and feel limited. So let's think idealistically for a moment, and let's say that you had the freedom to study what you were looking for. What's currently limited in scope as far as psychedelic science goes, and how can we give these areas more attention?
Well, I can talk from my personal view again, which, well, I'm specialized in pharmacology, and from my side would be the way in which these substances are being researched in terms of paradigm, because they are being researched with a classical pharmacology paradigm, the one created by Paul Ehrlich more than 100 years ago. And this consists in only studying isolated molecules of natural products and looking for selectivity and looking for elegant mechanisms and all these things. But most of these psychedelic drugs or psychedelic products are not from natural origin, contain hundreds or thousands of active principles, and I think it deserves to study these new products from another way. For example, there's a new paradigm called polypharmacology in the pharmacology in general that is trying to address these challenges, to take advantage of these complex natural products and to analyze their complex interactions with our body and with our systems. And I think this would be great to have this opportunity of a new paradigm that is being created, that is psychedelic assisted therapies, in general, psychedelic drugs. And this new paradigm also called polypharmacology, it would be great to combine them. We have published a couple of pieces about that. And for me, it's a pity that even being a new paradigm, we cannot use these innovative techniques and innovative paradigms to just study them. We are studying psilocybin in the case of psilocybin mushrooms. We are studying ibogaine instead of Taurolanthe iboga or other plants. So I'm very curious about what would be the outcomes of a trial comparing psilocybin and psilocybin mushrooms extract and see how it's working each other. So let's see.
Yes, before answering the question that someone from the public made, I would also answer your question regarding what would we do in the ideal world where we could research whatever we want with plenty of economical resources and so on. Well, I think that we have a very narrow approach to mental health. And now psychedelic research is quite focused in administering what substance in order to try to solve a mental health problem. For example, psilocybin to treat major depression or MDMA to treat PTSD. But both depression and among all PTSD and other mental disorders have a very important social, cultural, political, and economical component, what are called the determinants of mental health. So I think that the unique proper approach to the mental health problems is also researching what is happening in the structural level. What are the determinants that are in some way provoking these problems of mental health, because we are talking about poverty, about discrimination, about marginalization, about the stigma. So there are too many different things about social disequalities. So if we have to have adequate and proper tools in order to act on mental health, maybe we have to research also what are the different levels that are acting on the different or on the mental health of the population.
Yeah, that's an important area of focus that ICEERS does, and so that's something we can talk about as well. We had a question come in. Someone wants to contribute to research. They have 15 years of experience as a coach and facilitator. How would you recommend approaching this?
Well, for the moment, there is no legal opportunity of doing psychedelic therapies. There are clinical trials with psilocybin, with MDMA, and maybe you can join to one of the teams, of the different teams that are working with MDMA or with psilocybin in the clinical trials. But in the clinical practices, for the moment, it's not possible.
Great. So let's jump back to the discussion about global mental health, because that's an area of focus that ICEERS has been looking at for quite some time. And so I know that ICEERS has been working on this topic quite extensively. And how has this question or this topic evolved over time, and what currently is happening in the work of ICEERS with this topic? Maya, would you like to speak to this?
Well, we have several projects in plan to address not only global mental health, but global health in general. And well, as we said earlier, we also try to or are looking for ways how to incorporate different epistemologies and different approaches to research, and go a little bit, let's say, out of the box. But maybe I would mention some studies that we did and are currently conducting, more focused on public health in Europe, where we look into because mainly psychedelic research is also focused very much on what kind of diseases to treat. That's a very biomedical approach again, no? But we tried to look from the other side and looked at healthy individuals who are regularly participating in ceremonies, for example, with ayahuasca, and how this use or this participation in ceremonies is reflected in their health. So what we did was we used the indicators that national governments use to assess public health, and we passed these questionnaires to people who are regularly participating in ayahuasca ceremonies for a longer period of time. And the idea is also to tie this research with generating evidence for public policies, because the argumentation is always that a substance or a plant is dangerous for public health because it has a high abuse potential and has no medical value. So if we follow this logic, then a person who is regularly engaging in this use should have some sort of health problems, let's say, that we could find with these questionnaires that we were passing. And the thing is that from the study that we published that we did and published in Spain and in the Netherlands so far, we found that the people who regularly participate in ayahuasca ceremonies are basically as healthy as any other person, any other let's say average Spanish or Dutch person. So it doesn't seem to hold ground, this argument of some of the European governments that are trying or that are limiting or prohibiting ayahuasca use based on its risk for public health. According to our evidence, it's not posing a risk to the individual's health. We even found that the people are a bit, we're using less prescription medicines, for example, which is quite interesting to see. They were having a healthier diet. They were physically more active, let's say. They had less chronic diseases and things like that. So they even scored a little bit better on some of these indicators. So that is not to say that that's because of ayahuasca, but our conclusion was that ayahuasca can be seen as one of many self-care strategies that people use to maintain their health, to improve their health, to improve their well-being. I don't know if maybe Jose Carlos or Janice also want to add to this.
No, just to say that we are replicating these studies in different countries of the European Union and in Israel. And well, the idea is to have as many data as possible, because what we are finding is not that people have a better daily habits or quality of life because they take ayahuasca, but because they are worried because their health and they have healthy habits. This is why they take ayahuasca, and this is why they do yoga and do exercise and have a better dieta and so on. So this is these are evidence that led us to think that ayahuasca and even other psychedelics could be implemented into contemporary societies in a normal way without any drama and so on. The only thing that we have to take care is to do things well and do a proper regulation. But if in a non-regulation context we are finding these results, maybe if we regulate these practices, we will enhance the benefits and reduce the problems.
Mm-hmm.
Again, what we try is to generate evidence that could serve to the decision makers, the policy decision makers, to have elements and evidence in order to take decisions.
Mm-hmm. Yeah, so a lot of what you all do is focused on creating studies that show the impact on public health, and then that would be used as a context for policy creation in the future. And it's interesting times to do this work because we're looking at the cultures that have been disconnected from plant medicine and the cultures who have carried that lineage for so long. And then sometimes there is a cultural clash now, because a lot of times it's the cultures that are most disconnected from the medicines that are governing the laws. So into this vein, because a lot of what you're doing is to help support a different perspective on how science is conducted, And so how can researchers in general in this field do an investigation that does not cause harm to the peoples who have historically had these medicines as part of their cosmovision? So I know that all of you would have something to share about this topic.
Well, we can mention lots of things, no? We can talk about reciprocity, we can talk about the language we are using, we can talk about including indigenous people in the design or the interpretation of our studies, no? But I tend to think ultimately that, well, maybe we should adopt some humble position and assume that any approach that we use to study a traditional indigenous medicine would have an impact on the people that are already doing are already using this product, no? Because unfortunately we are living in a globalized world, and we don't know. We can have a lot of unexpected consequences about our studies, no? There's a lot of people that maybe wants to benefit from that from another way that we're doing, but there's a lot of demand. For example, if we find a therapeutic use of that product, the demand, the international, the global demand about this product would be huge and would be problematic for sure. And sometimes even doing the work as better as we can, we should just say, well, maybe the things that I'm doing maybe can have an impact and deserves reasoning, thinking time every day when you go to sleep about, well, I'm doing all that I can to assure a minimal impact of my work. And if it is not the case, maybe do something else. And if it is the case, okay, you can sleep. But yeah, it's something about harm reduction, no? As always, reducing the potential harms that your work can do in mid or long term, and maybe that's all. But I'm for sure that Maya also would have a more specific suggestions about that.
Maya?
Well, I think Janice already summarized it quite well, no? I mean, it's we should learn a little bit from history in general, not only in psychedelic research, how, and not have this mentality of extractivism and just implying our views on other people and thinking it's the best way, but also this humbleness in all possible areas, also coming to the field, to the research field with maybe a tabula rasa that can be filled in by other people that also know about the things, and be open-minded to for new perspectives and for new knowledge systems that might be unfamiliar and might be unlogical to us, but still create space for that, basically. And always self-reflect, and it's difficult to foresee all the potential negative effects that your work might have, but you can at least take all the measures possible to avoid them.
Jose Carlos, did you have anything else you wanted to add?
Well, I think that in a globalized world, the unique thing that we can do as a researchers is to try, not as a researcher, because at ICEERS we are researchers, but at the same time we are worried about the social situations in the world. So, as I said before, what we used to do is because there is a social intention. Is to try to create spaces where different people, different epistemologies, different disciplines, different kinds of evidence can dialogue and talk and meet, and I think that this is what from trying to have a non-decolonizing approach and non-extractivistic one. For example, we are starting now a project in the Amazonia, but everything is driven by the native people. So everything is done in conversation, in dialogues, and trying to research what they want to be researched, not what we want to be researched. So I think that for us as an organization, the way that we use is just to create spaces of dialogue.
Great, yeah, and it feels like a lot of people have this vision as well, that they're trying to do this work and with the best integrity to all people possible. And we had a very interesting question come in. Someone says that they're concerned about the biomedical model and how legalization could undermine general access, so making it so that there's more regulation, that these medicines are only allowed in the clinics. So they ask, what could we do for people pushing for community ritual psychedelic users to push for a democratic access to these tools?
Well, this is what we were talking before, that there is a tension between the medicalization and the biomedical model and the communitary use. And this tension, it seems that the biomedical model is winning, and if the biomedical model wins, it seems that the social model is becoming to be prosecuted. But I think again that this has many political roots and many political dimensions, and there is no an easy solution. And this is something that in ICEERS we are thinking continuously. What can we do? And what we try to do is to talk with decision makers at the different levels, in the local level, but also in the international level, in the scientific level, in the level of the authorities, in the level of the different public or governmental organizations. But it's not an easy way, because the easy way is to say, well, this the way of having access to these medicines is just the medical model, and this is the unique legitimate model. So, well, it's not. I don't have an easy solution for that.
Yeah, I would maybe just want to add that it's not only that we do work on, let's say, on a top-bottom approach, but also bottom-up approach, which means even if currently, for example, ayahuasca use is not criminalized, or with plants or substances that are criminalized, there is always groups or subgroups of people who still continue doing their activities, no? And the thing is that if legislations come in place that prefer medicalization and only in a clinical context, that means that all these groups will go even more underground and will have even more I mean, there are risks associated with that, no? So talking with the authorities about reducing these harms or approaching this issue from a way that will make it less risky for everyone, and to educate them, but on the other hand also to educate the people involved in these groups, and how to recognize or how to decide for yourself what to look for, how to choose places to go, basically what kind of criteria they should fulfill. For example, when we published the guidelines together with Generalitat de Catalunya about safe practices of ayahuasca facilitation during the ceremonies, but also participation, so it goes both ways. You as a participant should have the information that will help you to choose places where you will be taken care of, and on the other hand, people who are organizing these ceremonies, that they know what safety protocols basically they have to follow. No? So it's trying to work on all the possible sides, and trying to give proper information to all involved parties, basically.
Great, thanks for that insight. We had a question asking about if these types of live streams and content is available in Spanish. The answer is yes. Next week at this same time on Wednesday, we're going to have a live stream in Spanish. And then any page on our website is in both Spanish and English. So you can toggle between languages in the upper right corner. So our website is bilingual. Our staff, our team is mostly bilingual as well. So we're happy to offer this also in Spanish. And then speaking to the kind of clinical model, because ICEERS has perspective on this as well, because we have an ibogaine clinical trial. So I'd just like to know a bit more about how the clinical trial with ibogaine started and why ICEERS chose to focus on helping people to wean off of methadone. Jose Carlos, would you like to address this?
Yes. Well, this clinical trial started because, the ICEERS was created after Penn's documentary about ibogaine. So, since the beginning of ICEERS, we had the purpose of starting a clinical trial with ibogaine because there were not any double-blind placebo control with ibogaine. There were several studies, but our idea since the beginning was to promote clinical studies with ibogaine. And well, in order to predicate with the example, we started this clinical trial. And why we choose people with methadone? Because in Spain and in Europe in general, we have in the 80s and in the 90s a crisis of the heroin crisis, where too many people become addicted, and most of them could quit off from heroin because they started to enter into a methadone maintenance program. The problem with methadone is that although it's a very good medicine in order to quit off from heroin, it can create a iatrogenic problem, and too many people became iatrogenically addicted to methadone. So now we have a very large population in Europe and in Spain of people that is using methadone for 15, 20, 25 years, and they want to quit off, but it was quite difficult or impossible with the the standard approaches. So this is why we choose people with methadone. And well, we started the project so time ago, and we are now just finishing it. I don't know if Janice wants to add something to this.
Yeah, no, as Jose Carlos said, we are finishing this study. In a couple of weeks, the 16th and 17th participant will be included from a sample of 20. So, well, the results are being very awesome. I don't know how to describe them. Because the same people working in the center, we are doing the clinical trial in the hospital of Reus in Spain, and in the drug service area, no? And the people working there for 20, 30 years said, wow, why we are not using this from all of our career, no? Because this is actually an anti-addictive substance, no? And the first one we can know. And well, it was an opportunity to work with them as well, because this service in the hospital has a historical fight for harm reduction, for approaches considering more community aspects, not only biomedical factors, no? And for example, most of people working there started the first programs with methadone, the first programs with cannabis oil, with the treatment of some patients, etc. So they always were quite innovative and quite open to these new possibilities. And it is great to just work with them. And the project went so well, so smooth from their side, because they were so open and motivated. And well, for patients, it was very life-changing, let's say, because they were on methadone for 15, 20 years, most of them. And suddenly they can interrupt the use of methadone in some weeks. And well, for them it is being very special. And I remember some sentences, no, that some patients said about, well, now I can enjoy better just the sand in the beach, no, or just the sun, or the smell of the grass, or things like that. Because if it is not only interrupting the use of methadone and be free of that, it is also to be free of some opiate that has been in your system for a lot of time. And when you interrupt this use of opiates, you can be more sensible and more vulnerable to other stimuli, and you can be and just exist in another way, you know, and feel things different and more intensely, and these things, no? So it is being a ride for them. The study consists in 6 weekly sessions of ibogaine and 6 weekly administrations of a psychedelic. Well, it has an impact, no, in the person, independently on the use of methadone. And it is being a unique opportunity for me, and a beautiful process to just be there. Yeah.
Thanks, Shanice. And we've left a couple links in the chat regarding the clinical trial. So if you all want to look into that in more depth, you sure can. And something that's come up as we've been talking when we're discussing kind of the relationship that people have with plant medicine, you know, there's the clinical approach, and then there's kind of the approach that people have carried for centuries, which is being in relationship with plant medicine. So what kind of investigation has been done in relation to psychedelics, community, and self-care? Maya, would you like to speak to this?
Yes. Well, the fascinating thing, for example, with ayahuasca is that not only the plant or the brew is traveling from the place of origin, but it comes with its whole ritual with it. So it's really interesting to see, at least here in Europe, how different kind of rituals are being implemented or created even within different small communities that are using it to connect with the plant, to connect to themselves basically. And what we had the fortune to investigate was one of such micro communities in Catalonia, which was created, I think, more than 20 years ago. And it's a community that was put in place, let's say, by women. And what they did is they incorporated different kind of rituals, daily rituals as well, into everyday life basically, and created a space where everyone can come and share and be there and reflect on it, his or her life. And it's a practice that, as they themselves say, helps them to reconnect to their own roots, or to create some kind of practices that are long lost basically in Europe. So what I found really interesting is how they relate to the cannabis plant, which they call Santa Maria. And it's in today's world, it's not really that common that people would use it in a ritual way, which is exactly what they are doing. So they created a number of unique rituals basically, where they share Santa Maria in a group, and it helps them to it builds a sort of community between these people. It helps them to improve their well-being. It creates a place that I guess a lot of people in Western society are missing. It gives them a sense of belonging. And we had the opportunity to do research with them, to basically live with them, to participate in all these ceremonies and learn about their way of looking at the world. I don't know if Jose Carlos wants to add something to not take too much time.
Yes, this is something that is connected with what we were talking some minutes ago about global mental health. Because there is this movement that is called global mental health that came from the World Health Organization and from some other scientific communities that tries to carry mental health programs and systems to all the different parts of the world. The two principles of global mental health is that treatments should be based evidence and are respect for human rights. But not all the psychiatric treatments work, even here in this contemporary world. In what way? And on the other way, if we try to impose a strange medical system to other communities, this could be at the same time contrary to respecting human rights. So what we are trying to promote also from ICEERS, and we have a project in the Amazonia regarding this, is precisely that instead, or at the same time that this organization and the government implement resources in trying to research or implement medical systems in countries of low or middle incomes, maybe some of these resources should be in order to implement or to recognize the traditional medical systems that already exist in the traditional societies. And this is the case among all of the communities we work that work with psychedelic or with psychoactive plants. So this is another area of research in an area of interest to try to work in order to recognize the local medical traditional systems that have a very long tradition and that maybe they need to receive more attention instead, or at least at the same time, that there is an expansion of the psychiatric system. But we think that that these traditional systems should be recognized before trying to incorporate systems that don't belong to those countries. And in this way, we can think about it in traditional settings like the Amazonia or Mexico and other countries where there are traditional communities that use psychoactive plants, but we can also think in this approach in contemporary communities that are starting to appear, like is the case that Maya talked. And this is related also with the other question regarding self-care and autocuidados. That is the concept that where a community take care of the health, not like an individual, but like the community as a whole. So I think these are the different elements that are interrelated when we talk about global mental health.
Thanks. Yeah, and part of the discussion about global mental health and the evolution we're on is to create just policies for these medicines, because some people are, working with these medicines and they're facing legal trouble. So that's another program that ICEERS works on. We have the Ayahuasca Defense Fund that focuses on defending different plant medicine providers who may have had legal trouble. And it doesn't solely focus on ayahuasca, it focuses on different types of medicines. And so the research team also helps support this program. So how does the research that ICEERS does help influence the policy and the court decisions about plant medicine? Jose Carlos, would you like to speak to that? So we're talking about the Ayahuasca Defense Fund and how the research team supports
yes,
project.
correct. Well, this is what we were talking at the beginning. No, some of the researches that we design and develop from the scientific team is because there is a need in other areas of ICEERS, in other ICEERS areas that needs to be or that work with the community. And one of these areas is the Ayahuasca Defense Fund. So, well, we with the evidence that we accumulate with our different studies, and also, of course, with the studies that perform other scientific groups, we write technical reports in order to act as expert witness in the different trials where people is being prosecuted. So at the end, one very important part of the scientific work is because, well, it serves to other areas in ICEERS in order to Ayahuasca Defense Fund, but also to the education area and the training area or other areas like the different services that we have in order to help to the community. For example, the different questions regarding drug interactions that maybe Janice can explain a little bit, or the different other services that we have at ICEERS.
Yeah, I can explain a bit the Interact service. As José Carlos said, it is part of the support center of ICEERS, which is offering basically, well, two main services, but they are specialized in other areas as well, or at least these two are the most demanded. They offer help in integration of difficult experiences with plant medicines or other psychedelic substances. When you have a disturbing experience or you have troubles in coming back, let's say, to day-to-day reality, they help to just integrate the experience and accommodate that in order to not be so disrupting to you. And this is completely free, of course, from 5 to 10 sessions. And we have this Interact service because a lot of people, as you know, are taking medications. I'm taking medications, and a lot of people is taking medications, and a lot of people wants to use as well some medicines, some plant medicines or psychedelics, and they don't know if they can combine these plants or drugs with their medications, if they should taper off the dose or just interrupt them or some things like that. And we developed this service. Well, this service was started by Boso and his colleagues, and now we are a team of 6 medical doctors and 2 pharmacologists in order to answer these kind of questions, trying to provide some advice in terms of these pharmacological interactions and if the medical conditions that inform us can be problematic or not when using certain substances or plant medicines. So this is also for free, and yeah, the service is answering from now, well, hundreds of questions, and is working quite well, I think.
Thanks, Janice. Yeah, so we've shared a link in the chat about the Interact service. So if anybody has any questions about interactions between any medications they're taking and plant medicine, you can reach out. In addition, I don't see any more further questions from the audience, but if any questions should arise later, you can reach out to the research team at research@iceers.org. In addition, because we are a nonprofit, we continue to do the work based on donations from people like you. So if it feels in alignment, we would encourage you to donate if you are able. Any amount is greatly appreciated. And if you could also spread the word, if you know about anybody that does philanthropic work, we'd gladly love to continue to expand and grow as an organization and continue to offer all these free services. We offer services for the community, such as integration services, as well as the Ayahuasca Defense Fund, the Interact program, and many, many other programs that you can check out on our website. And we thank you all for coming, and it's been a pleasure. And we also next week at this time, so 6 to 7 European time, we'll have the Spanish edition. So if any of you would like to repeat or would like to be able to attend in Spanish, please tell your friends. And thanks for coming again.
Thank you to all, and thank you, Sarah.
Thank you.
Thank you.
Goodbye.